A woman who is facing a mastectomy and who has decided to undergo reconstruction may well ask me the question, gee, Dr. Harness, is it better to begin the reconstruction with the first stage at the time of the mastectomy, or should we do it on a delayed basis? I have a very strong feeling and philosophy about this, and that is that beginning the first stage reconstruction with a tissue expander at the time of mastectomy makes the patient feel more whole. It's part of what I call beginning the process of emotional reconstruction. Now, if a patient's having a reconstruction done with a flap, then again, that can be done immediately or on a delayed basis. With flap reconstruction, most of the plastic surgeons that I know want to do it on a delayed basis if the patient is going to have radiation therapy as part of the treatment of the mastectomy site itself. And then letting that mastectomy site heal up, usually a good 4 to 6 months after the end of the radiation therapy, before now swinging a flap in from the abdomen or from the back or whatever. This allows the tissue in the area to recover. Also helps with not having any potential radiation therapy damage to the flap itself. So the question, the answer to the question is, again, somewhat complicated. If it's really straightforward, patient is going to eventually have, let's say, a saline or silicone implant, then generally the first stage reconstruction is the placement of a tissue expander. I think most all of us prefer to do that at the time of the mastectomy. That's called first stage. The second stage reconstruction then is the placement of the permanent implant. Dealer's choice here, silicone, saline. Discuss these options with your plastic surgeon. On the other hand, if you're going to have radiation therapy but not going to have a flap reconstruction, then putting a tissue expander in at the time of the mastectomy, subsequently and then followed if you need chemotherapy and then radiation therapy, waiting again a good 4 months or more after the end of the radiation therapy, then the permanent implant can be placed. It's a complicated answer. Hopefully it answers your questions. Just keep those questions coming. We want to keep the answers coming to you here at Breast Cancer Answers. Hi, I'm Dr. Jay Harness, and I want to share with you important information that I believe that every newly diagnosed patient with breast cancer needs to know.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
about personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.